We've heard quite often since Aurora, since Newtown, that gun violence is intimately connected to mental health. Intuitively, that makes some sense, but what do we know about the people who commit gun violence? Joining us, our University of New Mexico psychology professor emeritus, Lynette Cofer. She studied the media and how children process what they see on television. And from the UNM Department of Psychiatry, Stephen Adelsham, who runs the Center for Rural and Community Behavioral Health, and David Graber, also with UNM's Department of Psychiatry. Like Stephen, he actively sees patients and is the Division Director of Child and Adolescent Psychiatry at the UNM Health Sciences Center. Now, David, we'd like to begin with you. We've seen tragedy after tragedy and study after study about mental health and guns. Still, the national dialogue isn't a consensus. So why is that? Why can we never get to a consensus on this? Because this has been a field of study for 2 or 3 decades at this point. What's going on here?
Well, I think in terms of gun violence and the mentally ill, I'd first say that one of the distressing things about the recent media coverage is this idea that gun violence is perpetrated by criminals and patients and individuals with mental illness. And I think that does nothing but increases the stigma, which exactly is the wrong direction that we need to be moving in terms of people getting adequate treatment and having access to care.
Now, let me ask you this: where does that stigma? What is that stigma about? What is that base of fear that stigma comes from?
Well, I believe in this case it's the portrayal of mentally ill patients as being in particularly dangerous and more likely to commit violence with guns than citizens without mental illness. There are 25% of the adults in the United States have a mental illness of some kind, and that's a large number of people. 22% of adolescents in the United States have a diagnosable mental illness with significant distress or impairment. So this is a very large segment of our population that suffers from mental health issues that many would benefit from treatment. And I think that portraying them as potential perpetrators of violence does us a great disservice. And in fact, there are many studies that suggest that having a mental illness is much more likely to place you in the role of victimization of violence.
Why would that be?
Well, because people that at times have mental illness, and especially severe mental illness, may have difficulty in ascertaining the context of various interpersonal relations, may not read social cues as well, and may actually put themselves in more dangerous positions with others. They're also seen at times as relatively easy targets.
That makes sense. Stephen, I'd like you to add to that, but then also in your research as well, this is a highly nuanced situation, certainly. But for folks who have mental illness and the idea in the public that one can read a problem coming, if somehow we just magically sit down these folks and say, with some kind of questionnaire, we can pin this person as a potential violent perpetrator. Is that part of the stigma here? How does the public get stuck on something like this?
Well, I want to, in terms of following up on David's point, I do think it's important to really acknowledge the fact that people with mental illness have much higher risk of being victims of violence, as he said. I think it's a critical point to make. And I think also when we look at the issue of gun-related deaths, in New Mexico, for example, 2/3 of the gun-related deaths are suicides. And in many cases, those are people who maybe have a mental health condition that may be treated or untreated, that are having a moment of crisis. And so guns can really be an issue to a great degree in terms of risk for people for violence to self. And it's something we really need to be thinking about as a state and as a country as well. I think in terms of your question about sort of the looking at the one point, as we all know, not only are mental health conditions multifactorial, but so is violence. And I think when we look at people often who are involved in violence, a number of studies talk about the effect of trauma. People who are abused might have more risk of becoming abusers themselves at later times during their life as a response to that, especially without treatment and support. I think there's also often biological aspects. Head injuries make people potentially more likely to maybe have a violent episode as well. But I think one of the things that's important for us to understand for mental illness in general, half of all mental health issues start by the age of 14, 3/4 by the age of 24. And what becomes very important, I think, for me and for many of the people I'm working with, is how we identify young people early. that might have mental health conditions and to be able to link them effectively to the supports that they need. And right now, we don't have systems in place to do that, both within our state, but frankly, even within the United States as a whole. One can look at models in Australia, New Zealand, all over Europe, where there really has been a much more concerted effort to build early intervention models, to target on adolescents and young adults, to build comfortable places for them to access services, to come talk to each other, to get peer support. And I think the stigma issue becomes huge because I think, Jean, you know, if someone said to you, well, who in your family has a mental illness? It's not a question I'm allowed to ask you, and it's not one you might feel comfortable answering. And I think for all of us, we all have families with serious mental illness across all of our generations. The stigma begins with us not feeling comfortable talking about it.
Interesting. That's well stated. I like the way you put that, actually. Lynette, since we're talking about kids now, in the idea that somehow, again, in the public's mind, we have been able to tell ourselves that it's all these external factors, media, gaming, other things that are informing kids that might be suffering with a psychosis or mental illness, that hastens or worsens the problem. Is that in fact what your research has shown, or are these other factors just not as big as we might think they might be?
Well, my research was focused on normal kids, little kids and preschool children, young children. But then we reviewed hundreds of studies. We wrote reviews on hundreds of studies of older kids and so on and so forth. Special groups, not special groups. But the consistent finding is it's not a silver bullet. And I said earlier, it's not unlike the controversy over cigarette smoking. The industry always said, you haven't proved it, you haven't proved it, it's one way. It's a one-way causal connection. Does television violence or game violence cause kids to become violent? You can't answer anything like that. People are complex and fuzzy, so what you can say is, okay, what we found, if you look at the preponderance of the evidence across the board, lab studies, correlational studies, field studies, and so forth, they all kind of go in the same direction, and meta-analyses support that. Is there an effect? Yes, but who it is? Okay, in our studies, normal nursery school kids, wonderful nursery school program, just 3 programs a week in the course of a fine nursery school day for a month. The boys who were more aggressive in the baseline period responded with significant increases in aggression, just normal nursery school stuff, okay? Well, does that mean that's not important? And then you look at what the findings are. Guess what? Those kids across the lifespan seek out more aggressive television and respond more to it. Does that make it less of a social problem? I would argue, no, no, no. We need very much to offer kids good alternatives and activities and kinds of things that bring them into communication with people. The other thing I'll just say quickly is the other result that isn't discussed as much is that children, no matter what their baseline aggression scores were, who were in this violent television, Batman, Superman cartoons of the 70s, which all the parents said, sure, you can show them that. Okay. They showed significant decreases in measures of self-control, like how tolerant are you if your juice is late at the table? Or what happens if somebody steps on your foot? Or how long do you continue with an art project? Whereas the children that saw the Mr. Rogers Neighborhood Program, this was exciting because nobody had shown this before, showed increases in lots of self-controlling kinds of behaviors and increases in communication. And we thought, so that's what we went on to build on, not continuing to look at the aggression stuff.
Sure.
But you think, what are we doing as a society? Because we're giving kids a constant diet that's much worse now than it was then.
And in that context of the constant diet and what we know now about how long actually the brain is developing, It used to be we thought we were all adults by 17 and a half or something, but we know differently now. Well into your early 20s, there's still a lot of development going on. So what happens in that nexus of what you're talking about there? When a kid's exposed to that kind of thing, but not quite fully wired, as they say, what's the potential there? What happens?
Gosh, I don't have any magic answers to that, but I'll say that I think what happens with a lot of kids is that their social contacts with family, with friends, with community are diminished, and they become more reliant on the excitement that comes from whether it's the latest program or the latest game, and they can become more isolated. Now, you all know more about this than I do, but that would be the
Dr.
my
Corabi,
take.
do pick up on that, because there's something interesting there. Yeah.
So I think, I think that Lynette makes a good point that, one of the things we know, these violent events are very hard to predict, and they're quite complex. I think most people would agree. But I think we do know that aggression in kids is a marker for potential aggression as kids grow. And so that can be helpful in terms of screening and early intervention. Aggression in young, even preschoolers and school-age children is an important behavior to recognize. And things that do improve pro-social behavior and support tend to be shown to be fairly effective in this group.
Right.
So that's one piece. I think the issue of development is quite interesting, and I think, again, how do people have the support of families and significant others? And the other piece, really, I want to go back to is this idea, getting back to violence, and the gun issue, is that of the 31,000 gun deaths in 2010, about 19,000 were homicides, but 11,000 19,000 were suicides and 11,000 were homicides.
And that's nationally.
And that's nationally. And even though these mass shootings are tragic, they're relatively rare events.
Interesting on that idea of suicide. Let me go back to that for a quick second, Stephen, because one of the things that I did not realize is that the length of time between the initial thought that a suicide moment is there in an actual event happening is less than an hour.
Right.
This is not something you plan for a week and then, after you get a report done, you go do this. But how does one, as a clinician and other in your field, how does one predict something in such a short period of time where you've got a potential disaster within an hour? That seems very difficult to me.
Well, the data says that someone like me is no better at predicting someone's suicide than anybody else, than you or anybody behind one of the cameras here. I think the issue is what we can do to build supports within the community, to build programs that are going to decrease that ongoing risk.
What would that look like to you? If you had your perfect Albuquerque template, what would that look like? How would we attack mental health issues to provide that support before that happens? What's missing in our city right now?
Well, I think, and this is a national issue, and I don't want to say just Albuquerque, is really so much the problem, but I think right now within our country, we have not really built the focus on mental health to the same degree that we have around physical health conditions. And so as a result, we have the stigma issues, as we've talked about before. We don't have, I think, the early intervention, early detection systems that I think we need. We're trying to build models of prevention in schools, and I think a lot of work needs to continue in schools because that is where the kids are, and that's where the families bring them, and I think they're incredibly important access points. We have had a commitment in the state to school mental health to whatever degree we've been able to, but certainly we don't have enough. We don't have enough schools.
How far off are we? How much more would you like to see in our state?
Well, I would like to see every school have the ability to have, not only a school counselor whose roles vary quite a bit from school to school. Elementary school, they might be more educational and do some small groups and things like that. I think as you get to middle school, it often becomes, unfortunately, more of a disciplinary role at times, or they get involved in scheduling and some of those issues. And in high school, it's the same, or there's a vocational component as well. But I think the mental health support issues are lacking in our school systems throughout the country. And I think we have a stronger need to build those partnerships. Federal legislation that was just put into the mix this last week or two, a mental health in schools bill on the federal level that would build community mental health supports with schools to link funds for additional services across a continuum. we need to be looking at more of those kinds of programs. And then within that framework, this whole issue of identifying young people early with the potential of serious mental health conditions. And if we can build in the screening programs, if families can tolerate us being able to do the screening because of the stigma issues or the concerns about being blamed. If someone says, we're worried about your child maybe facing some issue, and we need to do a better job of supporting families when those situations happen. But then I think we can, really have much better outcomes. I think as David and I worked on a study here in Albuquerque focused on identifying young people early, we did training all over the Albuquerque public schools that I think was much appreciated around those early warning signs, and we're able to see young people early. We have a program now.
Let me ask you a question. Is this doable for the layperson? Can the layperson with a little bit of training, I'm going to defer over here to David for a quick second, let him pick up on this. Can a layperson actually have the skill set to identify potential problems in a child?
Well, I mean, probably a general answer is yes, although I think that requires a fair amount of education.
Okay.
In most cases, people that know a young person best is their family.
Gotcha.
And so educating families is really important. And then, as Steve pointed out, when families identify potentially concerns, they have to have access to care. And for most, that really comes in terms of primary care, which raises a whole issue of how we actually, how behavioral health is interfaced with primary care. And there's initiatives federally that look promising. But for example, if you look at psychotropic medication in young people in the United States, if you look at all outpatient physician visits, about 14% of visits will involve a psychiatric prescription. And this is in general physicians' offices. Of those, 2/3 of those are written by non-psychiatric providers. So the bulk of psychiatric prescribing in this country is from primary care physicians who typically have limited, I will say, formal education. They may have a fair amount of experience. And that doesn't say that they're not competent in that. But I think, how do we actually leverage behavioral health services and expertise to primary care through schools is a really wonderful opportunity that really is not being capitalized.
I hear this feedback a lot, guys, all the time, that the school system is the point of entry for all of this. In fact, expanding the idea of the school psychiatrist or psychologist into a much bigger thing, almost a team system where you work with the family and almost work with a child all the way from elementary all the way through high school to keep a track on the family, Lynette, and just so you can talk about the things like gaming going on in the house. You can have a conversation where people anecdotally say, well, my kid seems to zone out on a game. I don't know what to do about it, these violent games. Would that be a system that you could support as well, that the school becomes a center clearinghouse for these kind of things for entire families?
Well, I would go a long ways with that, because I think we can do no better than Jane Addams at the turn of the century in Hull House. Hull House was set up as a place where families could come together. They could do drama, poetry, all kinds of different things, crafts, games, marvelous kinds of activities. But also, it was her way of saying, this is where civic education begins. This is how we learn to work together, talk together, and so forth. And there have been some wonderful studies financed by the Hogg Foundation in Texas, where they really picked up, by Wayne Holtzman and group, where they picked up on those ideas. And they opened up the public schools, really opened them up. So parents as well as kids could come for second language learning. They could come for swimming. They could come for lots of, and it's that kind of broader communication that's of such interest to me in prevention. And I think in that, when you begin to build those kinds of trusting relationships, then your kids are going to be more likely to be open, and their families, to meeting with mental health specialists or being identified, because they're going to be around people a lot more.
Interesting.
Well,
Please.
and we have had a history of family resource centers in New Mexico and in Albuquerque, and I think and actually one of the things around dealing with the mental health stigma is when you can link other services to the school setting, and people come in for multiple reasons, then you have the chance to ask those questions and deal with those issues. And whether it's access to other kinds of family supports, they become very important. And I know within Albuquerque and other parts of the state, those programs have been in place to some degree. I don't have a number for you about how much money we need to do it, but I think having that commitment and that expanded support would truly be valuable, I think, for many of our families, because the access issues do remain so difficult, and there's so few dollars that have really focused on the early detection. As we do screening, one of the issues becomes, well, you can't screen people if you don't have a place for them to get care when you identify an issue, right? So how do we build that capacity to then be able to even identify the issue? And if you look at asthma, if you look at diabetes, you wouldn't say, well, we don't want to screen for those issues because we're not going to know what to do, because we're committed to those physical health issues in a way we haven't made the same commitment to mental health issues. And I think by changing that, things could improve quite a bit.
Sure. I can't thank you enough for coming in. It's a huge issue, and I apologize that we can only kind of scratch at it with our fingernails a little bit. We'll have to have you come back and talk about this some more and have it non-tragedy based.
That would be lovely.
Right, exactly right. Exactly right. I had Eric and Regina Griego on their family's experience with the mental health community.